The Delta variant is the dominant strain of this virus, and it is driving the increase in COVID activity. While cases have risen over the past few weeks, our hospital capacity remains strong compared to the peak of the pandemic in 2020. As of Wednesday, August 4th, we have seen 1,166 new cases in a 2-week period for a total of 72,825. Sadly, 3 new deaths were reported, bringing the overall total to 1,400. Boston's positivity rate is now at 3.4%. We are nowhere near needing to create additional hospital spaces, and that is good news. But on Monday, August 2nd, the 7-day average of adult hospitalizations was 48, and as of that same day, Boston hospitals were reporting a 7-day average of 88% occupancy and non-surgical adult ICU beds. My team continues to monitor the data with a focus on getting residents vaccinated. I want to take a moment to address the comments about slavery and birtherism I made the other day. I wish I had not used those analogies because they took away from the important issue of ensuring that our vaccination and public health policies are implemented with fairness and equity. If vaccine passports were imposed today with a government mandate to ban unvaccinated residents from venues like restaurants or gyms, that would shut out nearly 40% of East Boston and 60% of Mattapan. Instead of shutting people out, shutting out our neighbors, who are disproportionately poor people of color, we are knocking on their doors to build trust and to expand access to the life-saving vaccines. We are working hard and successfully, increasing vaccination rates in every neighborhood. We've implemented a mask mandate for our schools, and now we are working with our municipal unions toward a vaccine mandate for our city workers. We will continue to follow the science and the data to protect every resident in Boston. We are boosting vaccinations across the city by partnering with trusted community-based organizations. We are particularly focused on communities hardest hit by the pandemic. Our mobile vaccination efforts are meeting residents where they are and making progress on distribution and access. We are driving vaccine access and information with targeted citywide outreach. As of Tuesday, July 27, over 400,000 Boston residents were fully vaccinated, and over 67% had received at least 1 dose of the vaccine. COVID-19 is a public health issue, and the response should involve the entire public. We must all do our part to fight the pandemic. Getting a vaccine is the best way to protect ourselves and our loved ones and our communities from this deadly virus. I want to say that again. Getting the vaccine is the best way to protect ourselves from this deadly virus. As mayor, I have placed vaccination at the center of our response to COVID-19 in Boston, and I've invested $3 million to boost vaccinations in communities that are hardest hit by the pandemic. We know that requiring vaccines in public venues will have a disproportionate impact on low-income families and communities of color. So our focus in Boston is to make sure that we are getting those vaccination numbers up across every neighborhood and in every community. I am leading by example with the City of Boston workforce. As I mentioned earlier, we have spoken to our employee unions, and collectively, we are actively working toward a mandate for vaccine or regular testing for all City of Boston employees. Our focus here in Boston is making sure that everyone has their shot at hope, and that means getting the life-saving vaccine. This is what we have been doing since day one of fighting this virus and to get our neighbors vaccinated. Boston is leading the way. That is why we are one of the most vaccinated big cities in America and one of the in one of the most vaccinated states in the country, and we are not about to stop now.